Welcome to Business Today Television. I am Siddharth Zarabi. We are here at the India Today Business Today studio at the World Economic Forum, and joining me now, Preetha Reddy, the Executive Vice Chairperson of the Apollo Hospitals Enterprise. Preetha, very warm welcome, and you know we need all the warmth here as the sun sets and it starts to get colder. I want to come straight to the point about your latest learnings and experience at Davos, interacting with so many people from across the globe. What's the big trends that you are picking up?
So it's been good listening to conversations, listening to great speakers. We've picked up, learned a lot. But I think two main themes are emerging. One, of course, on climate, what it's causing in the environment. To me, it's of particular interest because there's a direct correlation with the environment, with climate, and the way the health indices are changing. So the way the data was portrayed, the discussions on that, I thought were extremely useful. And we as humans have to be very conscious of the fact that, whether it's pollution or whether it's just the wrong kind of food in the wrong environment can affect our health. So from a health perspective, I think the conversations on climate control was amazing. Of course, we all love to hear, and we need to hear about the geopolitical risks on trade and how it's going to affect our economic forecasts. So I think some of those conversations were great. But more than anything else, there was a great focus, closed-door meetings, brainstorming sessions on the effect of AI on healthcare, the future of healthcare. And healthcare is going through its own set of challenges. There is this whole thing about disease X. We don't know what's going to hit us again, just like COVID did. There has to be preparedness for that, so we had conversations around that. But to use AI to be able to predict the onset of disease, of catastrophes which are health related, I think is going to be very relevant. To use AI for better diagnosis on the patterns, on the healthcare patterns, I think is good. But the other aspect of what AI is bringing for us is that we just don't have enough healthcare manpower. So from a skilling aspect, if we can really use this to deliver better healthcare at the right time, at a place which sometimes may not be in hospitals, I think that's a great help. Also, we as an institution, and I think the healthcare fraternity around the globe, is trying to see how do we keep people well, how do we keep people out of hospitals, and this is our biggest mantra of late. So from a wellness perspective, if we can be intelligent, if we can use intelligent systems to try and see that the onset of disease, catch it early. We do it with Apollo Pro Health. It's a whole AI-based tool, and it has the risk scores, and it will tell you that, if you have these patterns, you better go and check up for something, because mental health, obesity, blood sugar, diabetes, heart. So there's so many, the cancer, so there's so many things which can be caught early with the use of AI, and we are doing it at Apollo. And I think the global fraternity is, there's a group now which is coming together to use this for data points.
One of the important questions in India around healthcare has always been costs. And you are yourself aware of that. You provide extremely advanced super specialty healthcare access also, and of course, down the value chain as well. But do you see the prospects of AI contributing and allowing healthcare providers like your company to be able to lower or make certain kinds of healthcare more affordable?
I think we have to really compare apples to apples. Some standards of healthcare have to be done, at a certain cost. But India, if we could put Chandrayaan on the moon at 1/10 the cost, we should all work hard to reduce costs. So I think that's a commitment which we have to make. And having said that, if we can use AI to track data better, to track productivity better, to track the usage of drugs better, I think that will play a large role on bringing costs down. So everybody is working towards bringing costs down to provide more access.
I wouldn't have, but I will, because it's Preetha Reddy here with me, narrate a personal experience, viewers. Some of you might be wondering what this splint is all about. On Monday evening, I slipped here. Davos is infamous for that. And I experienced the healthcare system. No negative remarks really, but one of my colleagues who was accompanying me, our VJ Mohsin, said at the end of that experience that इतने में तो इंडिया में सर हार्ट सर्जरी हो जाती है. This was one of the things. So sometimes we talk bad about our healthcare system. I can tell you that I am going to go back and perhaps get better care and at much lower costs. This was a personal point.
Well, I feel bad you slipped. I wish you didn't have to go through the pain.
But I learned.
Thank you for, complimenting Indian healthcare. And let me tell you, I've been sitting with, the highest level of people within the US or Europe. We're all, talk together. We're working on the Governors Council. They're all amazed at what India has done in the healthcare space, and they said we never realized that a country could do it, and they commend India on the way we handled the COVID or the vaccines.
And I must add to that another learning, and I'm a doctor's son, was that Indian healthcare professionals, including our doctors, are outstanding, especially in emergency rooms. The amount of trauma that they see and their ability to handle crisis is absolutely fantastic. But coming back to the topic, COVID taught the entire industry a lot of lessons. We are out of COVID now. One of the aspects that Apollo is known for is providing, it's called medical tourism. I don't like that word. You are providing healthcare to those who don't have it in their home countries. What's been the trend shift after COVID? Are you back at the same kind of numbers that you used to get prior to that?
I think the numbers have come back to those levels. And I don't really, we shouldn't really call it medical tourism.
Exactly.
Because it's the value which Indian healthcare is bringing to countries which don't have it.
And do you see this growing? Go ahead, please complete your point.
No, you spoke about this accident which you had, and this is a so-called developed country. We just do things quicker, faster, and great outcomes.
And at much lower cost.
Yeah,
at much lower
great
cost.
outcomes. So why would people not, seek healthcare in India? And the trend is growing. It will continue to grow. We just have to see that we do it the right way, and we really focus on quality and on outcomes, and be able to deliver that promise, because at the end of the day, it's brand India. It's a country which has really come a long way, and it's everyone's responsibility to deliver those kind of levels.
One more point that I would like to ask you about, the role that insurance is increasingly playing in providing and insuring people against health risk. Is that a point where much more needs to be done in terms of greater access to insurance and perhaps lower costs as well?
Insurance is going to grow in India. The good thing is, and we were the pioneers, we worked with governments, is that most states have the Chief Minister's scheme, especially in the south. We started it with the CM at that time in Tamil Nadu, then Andhra Pradesh, the undivided, Andhra, it was Arogya Shri there. Karnataka picked it up, but all the states are picking up, some form of healthcare interventions for the people, and I think that's a good thing. It is reinsured, so that is coming together very nicely. The insurance penetration is very high, and the insurance market is going to grow, because more people will then get access to healthcare, which is expensive. There's no going away from it. And in a way, that's the answer for access.
My final question, since you spoke about expensive healthcare, what could your industry look forward to, perhaps not in the interim budget, but beyond that in the full budget in July, in terms of allowing you to provide even more affordable healthcare to those who deserve it?
So one thing is, it's not expensive healthcare. It's just the cost of the product. And it comes at a certain cost, because it's input costs. In manufacturing language, it's input costs. So I don't think it's expensive healthcare. And as the budget goes, as usual, everyone will go and make a request to the government. But a lot of it is still about building infrastructure. So if more support can be given to healthcare so that it grows for the next 5 years, that we're allowed that complete infrastructure status. There's some of it has come already, but we're just waiting to see if that can be done. I think that would be extremely good. There is, of course, this whole thing on GST. But it is what it is. So I'm not even going to say we want it or we don't want it. We just have to learn to.
Many industry professionals are torn between the benefits that GST has brought for business versus some of the other aspects. But like you said,
I just want people to benefit from what happens, because education and health is a fundamental right. It is our responsibility to give high standards of healthcare to the people of our country and maybe to people of the other countries. So we have to just do what we have to do.
And since we are here in Davos in Switzerland and I had an experience of the healthcare system, I can tell you our healthcare system, despite some of these perceptions and myths, is very, very good when it comes to taking care of 1 billion plus people. Of course, a lot more needs to be done, and people like Preetha Reddy and her company are doing that not just for Indians but for people who come to India for getting their diseases treated. Preetha Reddy, thank you very much for your time. With that, it's a wrap on this conversation. We'll be back with more. Until then, goodbye.
Darwin Platform Group of Companies is one of the fastest growing diversified Indian conglomerates with global footprints. It is setting up offices globally and tying up with companies across the globe from multiple sectors. The company has ventured into real estate and construction, stockbroking and finance, arms and ammunition, mining, airlines and many other sectors.